The ankles, you want to place them outside of the knees, and then this is essentially a Nordic curl, but we are focusing on the semimembranosus because of the orientation of the tibia. From this position right over here, you want to maintain that retroversion of the pelvis, and you want to hinge forward as far as you can without... Hey everyone, thanks for tuning in. Steven here with Team Euphoric, and today I'm joined by Michael from One Body, and today we are going to be demonstrating the top 5 segmental strengthening exercises for low back pain. The exercises that we are going to be covering for today are going to be for the Gluteus Maximus, the Gluteus Medius, the hamstrings, the Rectus Abdominis, and the Quadratus Lumborum. Without further ado, here are the exercises.
Okay, we're going to do the segmental strengthening of the glute max. Steven is on his back. He's going to retrovert his pelvis. He's going to keep his eyes looking to the knees. The first line we're going to do is the medial portion of the glute max. You're going to have his feet together here. He's going to open his knees. He's going to slowly push his hips up in the air. He's going to articulate his vertebrae down. Do not let the bum touch the floor. Up and down, nice and slow, controlled movement. Okay, the next line we're going to do is the feet apart and knees apart, which is the lateral medial. He's going to push the hips up in the air and roll it down. Squeeze. Don't let the bum touch the floor. Excellent. And the next line we're going to do is feet together and knees together, and that is the medial lateral. Hips up in the air, rolling the spine down, keep the bum, do not let it touch the floor, up and down, rolling it down, keep the knees together. And the next line we're going to do is the lateral. He's going to open his feet up and keep the knees together, and he's going to push his hips up in the air and roll the spine down again. Good. Do not let the bum touch the floor. And there you have it. That's the strengthening of the glute max in all 4 lines. Steven is going to bring his legs up into a 90-degree position on a sideline position. He's going to rest his head on his bottom arm there. And the pelvis is in retroversion. He's going to take his top leg and he's going to bring it out to the front here like this in the posterior fibers of the glute medius here. He's going to have the leg just slightly bent at 5 degrees. He's going to turn the big toe down. He's going to think about pushing the knee and hip away from the leg away from the hip and lifting the leg up and down. And that's the posterior fibers of the glute medius. And then we're going to go to the middle fibers of the glute medius, which is down in a 45-degree angle. He's going to turn the toe down. The leg is still slightly bent, and he's going to go up and down again in the middle fibers for the glute medius. And final line is the anterior fibers of the glute medius. He's going to pull the leg down into a 180-degree position. And again, he's slowly going up and down. Toe is turned down and lifting up and keeping the hips stacked. And there you have it. That's the strengthening of the glute medius in all 3 lines.
All right, the third segmental strengthening exercise, we're now going to be working on the hamstring. Specifically, we are going to be focusing on the semimembranosus muscle. If you recall, the hamstring, we had the semimembranosus, which is closest to the midline. We have the semitendinosus down the middle, and then the biceps femoris on the lateral aspect or the outside aspect of the hip. For the semimembranosus, if we want to focus on the distal fibers, meaning closest to the knee, we are going to be in a prone position. So Michael is lying down on his stomach, and what you want to do for this one right over here, you want to start with your ankle outside of your knee, and then you are going to flex your knee as much as you can and bring it across so that your heel tries to go toward the opposite glute. And I'm just going to have Michael do this a few times. This right over here is for the segmental strengthening and reinforcement of the semimembranosus, specifically the distal fibers. If we want to then target the intermediate fibers, meaning the fibers in the middle of the hamstring group, I'm going to have Michael go into a 4-point position. So he is going to be on his hands and knees, and with this one right over here, what we want to do, same thing. The ankle is starting out outside of the knee, and Michael is going to bring his heel toward his butt, and when he brings his heel, he's not only flexing the knee, but he's bringing his ankle across his body. So if you're working on your right leg, you are trying to bring your right heel toward your left glute. And this is for the intermediate fiber of the semimembranosus. Then, if we want to target the proximal fibers, meaning the fibers closest to the ischial tuberosities, then we would get into a tall kneeling position. So I'm going to have Michael on his knees, and with this one right over here, we want to bring the ankles outside of the knees. So I'm going to have Michael go on both of his knees. We're going to be doing a bilateral version of this exercise. The ankles, you want to place them outside of the knees, and this is essentially a Nordic curl, but we are focusing on the semimembranosus because of the orientation of the tibia. From this position right over here, you want to maintain that retroversion of the pelvis, and you want to hinge forward as far as you can without losing the retroversion of the pelvis. These fibers right over here, they're going to be really weak in a lot of people. So a lot of people, they're not going to be able to go all the way down. The end goal for this exercise is to be able to go all the way down to the floor, but if you're unable to do that, just work with the range of motion that you have available. As soon as you start to lose that retroversion of the pelvis, pop right back up, and then as you get better and stronger, you're going to be able to get lower and lower down to the ground. Now that we've done the semimembranosus, the fourth segmental strengthening exercise is going to be for the rectus abdominis. And for this one right over here, we're going to be focusing on both the supraumbilical and the subumbilical fibers. Supra meaning above, sub meaning below. So the supraumbilical fibers, we are going to be focusing on the upper abdominals, and with the subumbilical, the lower abdominals. For this one, I'm going to have Michael lie down on his back. He is going to place his hands out to the side at the level of the glenohumeral angle to stabilize the scapula. With regard to his feet, he is going to keep them exactly where they are right now. You're flexing your hips and knees. His eyes, he's going to look down between his thighs to put the dura mater under tension. And then with regard to the supraumbilical, I'm going to have Michael reach forward with his hands, and he is just going to curl and uncurl his spine. So with this one, he doesn't even need to go that high, because right now we're focusing on supraumbilical. Because it's supraumbilical, the belly button is roughly at the level of L3. So I just want Michael to curl up to the level of the L3, and then once his L3 comes up off the floor, that's it. You don't go any higher than that. And this is the segmental strengthening for the supraumbilical fibers of the rectus abdominis. Then, if we want to target the subumbilical fibers, we're in the same position, only the arms are out to the side to stabilize the scapula. Eyes are looking down between the thighs. Hips and knees are flexed to 90 degrees. And then for this one, we want Michael to drive his knees up toward the ceiling as high as he can, up to the level of the L3. A lot of people, they're going to be really weak in this position. So if you're unable to lift all the way up to the level of L3, that's perfectly fine. Some people, you might just be able to lift up enough to slide a piece of paper. Play with the range of motion that you have available. One thing worth noting is you want the femurs perpendicular to the ground. So I can have Michael go into a little bit of extension, and then you want to drive the knees straight up toward the sky. So you want to drive them up without flexing the hips even more. So right there, if you need a little bit of a biofeedback mechanism, you can place your hands and just have the patient or client raise the knees toward the sky without touching your hand. And this is the segmental strengthening and reinforcement for the subumbilical fibers of the rectus abdominis. And then lastly, we are going to do the segmental strengthening and reinforcement for the Quadratus lumborum, or the QL muscle. This is a deep stabilizer in your lumbar spine, and it is the root problem for a lot of people that have low back pain. This muscle right over here, to strengthen it, you are going to place your non-working leg on a surface that is going to allow you to elevate the working leg. And then the opposite arm, you are going into full flexion. You are going into external rotation to stabilize the scapula. The chin is tucked in. The eyes are looking down toward the floor to put the dura mater under tension. And then you are basically just elevating and depressing the ilium, or your pelvis. So you want to drive your pelvis as high toward the ceiling as you can, and then drop it down toward the floor as low as you can. So imagine that you are trying to compress the space between the rib cage and the pelvis when you are contracting it, and then when you are relaxing it, you are trying to create as much separation between the rib cage and the ilium. But that is the segmental strengthening and reinforcement exercise for the Quadratus lumborum muscle. And there you have it. Those are the top 5 segmental strengthening exercises for low back pain. Perform all of them, see which one's you're weakest in. Whichever one you're weakest in, that's probably the one that you're going to need the most. But if you need a little bit more information, we're going to be covering all of these exercises on our seminar on September 18th. That seminar is going to be for low back pain, shoulder pain, and neck pain. So if you have any type of issues in those areas, or if you are a clinician who treats patients with the issues in those areas, then definitely check that out. In terms of this week, on Friday, we're going to be doing the top 5 myofascial stretches for low back pain, so be sure to check that out. It's going to be dropping Friday at 2 p.m., but that's it for today's video. If you enjoyed the video, be sure to smash that like button so we know to continue making these types of videos in the future. And if you're either new to the channel or haven't subscribed yet, be sure to subscribe to the channel and hit the notification bell, as we will be uploading new videos every single week. That's it for today's video. Thanks for tuning in, and we will see you again tomorrow.